Welcome back to Sleep Better TV. I'm Tasia Custodi, and my guest today is Dr. Don Slayback of the Craniofacial Care Center in Columbus, Ohio. Thank you so much for joining us once again today.
Thank you for having me.
So Dr. Don, I'd like to continue our talk about obstructive sleep apnea, and it's linked to obesity. So why is obesity associated with OSA?
Well, obesity is the single most common cause for obstructive sleep apnea, according to most studies out there. Couple of things. As we gain weight, especially if we gain weight in the neck, it tends to collapse in on the structures of the airway, making the airway more collapsible. Abdominal fat also tends to push up on the lungs, which can allow the airway to collapse even further just from that additional pressure.
So then, if weight is such a problem, why do some people fail at their weight loss attempts when it comes as a treatment option of OSA?
Well, unfortunately, weight loss is often given as an option or as a treatment alternative. You know, go home and lose weight, which makes people very happy to hear that. But the problem is when a patient has obstructive sleep apnea and they're having all kinds of events at night that are lowering their oxygen levels and interrupting their sleep, it's kind of hard to make them or suggest to them that they need to roll out of bed and bound to the gym and work out as an option to fix this. The other thing is there are a lot of hormones associated with appetite, as well as just some of the feel-good hormones that get dysregulated, get messed up when patients have obstructive sleep apnea. So they have increased appetite, they tend to want to eat particularly carbohydrates, they have more cravings, which is totally not helping a weight loss program. What I have found is that a lot of obstructive sleep apnea patients, once you treat the apnea, they tend to lose weight because the hormones get more imbalanced. They tend to have more refreshed sleep, so they have more energy, they want to go work out. I have found that it's kind of a vicious cycle, that maybe obesity causes obstructive sleep apnea, but I think obstructive sleep apnea certainly can contribute to obesity, and so it is a vicious cycle.
So then where does metabolic syndrome fit into this spectrum?
Metabolic syndrome refers to kind of a combination of conditions, obesity, blood fat dysregulation, as well as high blood pressure. All those things are also associated with obstructive sleep apnea, to the point where the features are so similar between the two that they are so interwoven that most patients with metabolic syndrome clearly have obstructive sleep apnea as well.
Thanks for your time, Dr. Don.
Thank you.
My guest today has been Dr. Don Slayback of the Craniofacial Care Center in Columbus, Ohio, and you have been watching Sleep Better TV.